In this video presentation, we will discuss a case study of acute stimulant-induced psychosis, and it's covered by background, objectives, methods, results, and conclusion. The presenter will be Viola Isabella, Livardo Winona, Rivera Andre, Mangana Renz, Sinchonco Ason, Guevara Maynard, and Ramos Jillian.
Background of the study. The use of stimulants as prescription and illicit drugs is widespread. Stimulant drugs include cocaine, methamphetamines, amphetamines, nicotine, and ecstasy. These medications primarily speed up the activity of our central nervous system, which increases how well our bodies function. Additionally, it raises dopamine levels in the brain, which increases heart rate, alertness, and energy levels. In this case study, we evaluate the influence of stimulant-induced psychosis caused by excessive usage of amphetamines. Prescription stimulants increase the levels of certain neurotransmitters in the brain. It results in the common side effects of these medications, such as increased focus and concentration. However, it is not intended to improve performance in the general population, but rather as part of a comprehensive treatment plan for carefully diagnosed conditions such as attention deficit hyperactivity disorder.
When doctors prescribe ADHD stimulants, they start with a low dose. If they need more, they gradually increase their dosage while keeping an eye out for side effects. Side effects are more likely when these medications are not taken as prescribed without a prescription. These symptoms include difficulty in sleeping, loss of appetite, high blood pressure, irregular heartbeats, and nervousness. In addition to the study, according to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, that medication-induced of psychotic disorder can result in hallucinations with symptoms of intoxication or withdrawal, which result in delusions and hallucination, which is clinically significant to impairment. Acute psychosis, when induced by stimulants, it occurs within 4 to 5 days after the intoxication. As a result, regular use of stimulants, particularly in appetites and methamphetamines, has been found to be a significant risk factor for the development of chronic psychosis or syncophrenia, in addition to the risk of inducing acute psychosis. Stimulant-induced psychosis is a mental health condition in which someone temporarily interprets the world differently than those around them. Drug-induced psychosis occurs when you have psychotic episodes such as delusions or hallucination as a direct result of substance abuse.
Who gets psychotic? Of course, we see this in psychiatric illnesses like schizophrenia, bipolar disorder, and even depression. But you don't have to have a psychiatric disorder to become psychotic. You can become psychotic from medication effects, such as steroids. Ever hear the term steroid psychosis? Other common culprits are illicit substances, such as marijuana, or hallucinogens, like LSD. And psychosis can also result from medical problems like seizures, thyroid disease, or even after a woman has a baby. So what do we do about this? Well, you treat the reason. If it's from a medical illness, you treat that illness. If it's from a psychiatric disorder, the treatment is medication. And sorry to say that for the pill haters out there, but someone just can't be talked down from their delusions and their psychotic symptoms.
One approach for you to learn more about our goal in the case study is to read the objectives. Our goal in the case study of acute stimulant-induced psychosis is to inform individuals about the potential negative effects of stimulants that may have. Educating people about the effects of stimulants on our lives, to comprehend the feelings that come from utilizing stimulants. The aim of the case study is to investigate the cases of specific stimulant users, psychosis, and discuss the idea that abrupt stimulant usage that can cause psychosis.
The objective of the study is to examine why one particular stimulant user experiences stimulant-induced psychosis. This study also wants to educate people that stimulants can also be beneficial for treating some medical conditions such as attention deficit or hyperactivity disorder, narcolepsy, obesity, and depression. And also to warn people that using stimulants regularly can lead to chronic psychosis, and to help people to be aware of the symptoms of it, like hallucination and delusions. Generally, the study focuses on acute stimulant use is resulting psychosis and help to prevent those who are vulnerable for abusing stimulants.
Good day. I am Insusin Chongko and I am tasked to present the methods used to solve the phenomenon of an 18-year-old Caucasian boy with acute stimulant-induced psychosis. This particular part of the case study provides the methods used to solve the phenomenon of acute stimulant-induced psychosis, general provided method, and a case-based method. Let's deal with the general methods of stimulant-induced psychosis. The first provided by the researcher or the one who write the case study is number one, the pharmacological treatment or intervention. Relating to the branch of medicine concerned with the uses, effects, and modes of action of drugs. And after appropriate pharmacological treatment, some patient and most of the patient shows a gradual improvement over the next 5 days to 1 week after a certain hospitalization. After 5 days, he was allowed to be discharged, and there were no delusions or hallucinations reported afterwards. He was referred to a local mental health center for a follow-up discussion with a psychiatrist. Next provided method is the antipsychotics and psychological involvement. When we say involvement, it is the interaction of the specialized field of people under the psychology field or a psychological matter of knowledge. They can help to reduce and control many psychotic symptoms. And let's now proceed with the case presentation method and providing solution on the said 18-year-old Caucasian male with no prior psychiatric hospitalization stimulant-induced psychosis. The first one is the atypical antipsychotic risperidone 1 mg BID, where BID means 2 times a day. Risperidone 1 mg or ml oral solution is a clear and colorless solution. Risperidone is also indicated to treat schizophrenia. Risperidone is also indicated to treat moderate to severe manic episodes associated with bipolar disorders. The second one is psychotherapy session. And those are the presented methods by the researchers or by the authors of the case study.
Hi Mom, guess what? I've got a friend.
2 birds on a wire. One tries to fly.
On this study, the frequency of psychosis due to acute toxicity varies widely, subject to the types of substance used. As per their findings, it resulted that there are 276 males presented to the emergency department, in contrast to only 72 females. This may be due to the fact that males tend to participate in more risky behaviors than females. If result of the mentioned disorder, individuals who undergone psychosis tends to exhibit uncharacteristic display of temper, state of being paranoid, and getting irritated much easier than that was the convention. Sleeping habits were initially disrupted along the changes upon the custom interaction towards one's social network. The aforementioned disorder also resulted in the impediment of one's habit and preceded interest. Hallucination and delusion were also fastened to consider relative to the disorder being discussed. In addition to the risk of inducing acute psychosis, regular stimulants, especially amphetamines and methamphetamines, has been found to be a major risk factor leading to the onset of chronic psychosis or schizophrenia. Furthermore, patients with previous stimulant-induced psychosis are the greater risk of subsequent episodes.
Psycho killer, qu'est-ce que c'est? Better run, 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 run away.
So, the case study focuses on finding out the reason on why one particular stimulant user experiences stimulant-induced psychosis. It was said that psychosis is a symptom of a mental health illness and it was found out that there were 74% of people who had been diagnosed with it. One of the patients was an 18-year-old Caucasian male and he was sent by his parents to the Nervi hospital because of changes to his behavior, like he became moody, irritable, and paranoid. During evaluation, it was discovered that the patient had been diagnosed with ADHD that was seen to be the symptoms he experienced and was caused by overuse of amphetamines. Moreover, it has been found that the risk of inducing acute psychosis and regular use of stimulants like amphetamines is a major risk factor for chronic psychosis or schizophrenia. An excess dosage of amphetamines appears to be the underlying factor that led the patient to the emergency department. It was shown in the study that taking dosage of the stimulants over a short period of time plays a big role in causing psychosis for the patient with no psychiatric history. Before concluding, there should be follow-up research and documentation as to whether psychosis happens again. They have also concluded that the understanding of the progression of the disease is essential in improving patient care. One of the vital conclusions of this study is that usage of substances is a major cause of psychosis, and before prescribing stimulants to any patient, physicians must be careful to obtain the specific history of each individual patient. For those who are prone to stimulant-induced psychosis as a result of their medical history, a family history of mental illness, genetics, and lifestyle, must be advised and warned of the signs and symptoms of psychosis. The case study shows that it affects a person's health, so they should not take stimulant-induced psychosis such as amphetamine, cocaine, methamphetamine.
Weird things that I tend to do when I'm in psychosis part 1. Also, if you're new here, hi, I have schizophrenia. So more often than not, when I'm in a psychotic episode, I have this recurring delusion that the apocalypse is about to happen, but I can survive. So my brain thinks, okay, well, I've seen The Walking Dead, and if the apocalypse is about to happen, I'm gonna need to eat. You know, this food is gonna go bad. I can't just leave it here. So I will literally eat everything that I have in the house. Example, about a month ago, my partner went shopping, bought a bunch of my favorite things, and then later left the house. When he came back home that night, he opened the fridge to get something to eat and was like, "Did you eat?" I was like, "No, I don't think." "Oh, yeah. Oh, yeah." What he didn't know is that while he had left, I had a psychotic break. Thought that the world was ending and decided that the best idea would be to stock up on nutrients, meaning all of the food that we have.